Now, recently I talked to someone on the phone who was very, very, very frustrated. She was crying. She was protesting because her husband was losing weight. Her friends are losing weight. She's eating healthier than them, and she's not losing the weight. She said, I'm doing everything right. It's not working. I don't understand why it's not working. Maybe I need to go back to another diet. Maybe I should do this or do that. She's just very frustrated that she has to spend so much work with so little result. Now, when you're evaluating something like this, you need data. You need to get data from the person, and you're comparing what they're doing to what they should be doing to try to find out what's going on. Number one, she says, I'm not losing despite having a good metabolism. Okay. So the next question is, what makes you think you have a good metabolism? Okay. And she said, well, I eat a lot of food, a lot of calories, but I don't gain weight. I just can't lose weight. And she's 20 pounds overweight. Okay. So because she's eating a lot, she's not gaining weight, she's thinking she has a good metabolism. Now, if we just isolate what her problem is, she has a certain set point, okay? A certain weight that she cannot get below no matter what. It doesn't necessarily go up, it doesn't go down. Her body just loves to be at a certain weight. What she didn't realize is what's really behind the set point. So if your focus is on exercising more or eating less, and you don't understand what's behind this, you're not going to get results. What's behind the set point is very severe insulin resistance. And insulin resistance is a situation where the insulin is no longer working anymore, and the cells, okay, won't let the fuel in, because one of the purposes of insulin is to allow fuel in the cell, okay, and nutrition in the cell. If it doesn't go in there anymore, your cells will be starving of fuel. They won't get the nutrients, and that extra fuel that you do consume is being stored as fat. And what happens as a compensatory thing, the body compensates and makes more and more and more insulin. And the more insulin you have, the more of this set point you're going to have. And no matter what you do, I don't care if you exercise 6 hours a day, like the weight just doesn't barely come off, okay? It'll just be stuck at a certain point. We'll come back to this in a bit. Next thing, keto is not working, okay? Now, it was working for the first 2 weeks, and then it stopped working. Find out she's doing a lot of keto bombs with dairy as the fat in that keto bomb. Okay, we'll talk about that in a second too. We'll come back to that. Next piece of information is she is fasting, she said, but for 12 to 15 hours. Okay. What I told her was that she needs to be at least 18 hours to start fixing insulin resistance. 18 hours fasting to really start seeing the change. If you have a bad problem with insulin resistance or a slow metabolism or this stuck set point, 18 hours is the starting point, okay? If it's less than that, it's going to take too long, all right? Next piece of information. After the first 2 weeks when she lost weight, then she got her period. For the next 2 weeks, she had severe menstrual cycle problems, okay? That usually comes from dairy. When you consume dairy, especially if it's not quality, and I'm talking about grass-fed organic, just dairy products from regular milk, okay, it's not grass-fed, it's not organic, that's going to add a lot more estrogen and other hormones, and that's going to throw off your cycle. Okay, action steps. Number one, be very cautious on who you get advice from. You have her friend, her personal trainer, her doctor all giving her data. What's happening, she's getting too much data overload. She doesn't know what's the vital stuff, the true stuff versus the trivial versus the false. And you're just swimming in a sea of data and you're not sure exactly what to do. A couple things that I mentioned to her is that you don't ever want to take advice, especially related to weight loss, if that person or expert has a weight problem. Okay, it's like going to a dentist with bad teeth, okay? You're not going to get the best information. You want to go to someone who gets amazing results, not necessarily has a certification, okay? A lot of times when you go to Google and you do research on the first, second page, third page, you have all the credible sites that are first, right? They're all medical sites. because they're certified. They're more credible, right? But I'm looking at the information. It's not very effective. It's not going to work. So if you're trying to do research or find the truth on the internet, sometimes it's very difficult because you don't know who to believe. Credible is the person who gets the best results, okay? All right, number 2. I told her to hyper-focus on fixing insulin resistance. In her mind, she's like, well, I can't give up these keto bombs and dairy because I can't even think about doing this long term because it wouldn't be enjoyable. I said, don't focus on the long-term healthy eating plan right now. We have a big present time problem. We need to fix this. We fix this, then we can actually think about what you should do as a maintenance or a long-term plan. But don't focus on anything but insulin resistance. So that means you need to actually do intermittent fasting a lot longer, okay? That's the number 1 thing. Number 2, you need to bring your carbs down a little lower. Apple cider vinegar can really help you. And you need to increase the more fat at the meal only, not between the meal, but do it non-dairy, okay? Because I think that's what's messing up her cycle. But more fat at the meal will allow her to go longer with intermittent fasting. Now, there is a valid point of consuming too much fat and having your body use the dietary fat as your ketones and not your own fat. But we're not actually interested in that at this point. We're interested in fixing insulin resistance by doing intermittent fasting longer, okay? Because if we don't do this, we can't fix this. And this is way more important than trying to lose weight at this point. We're trying to fix the underlying cause of this. And to do that, we must do intermittent fasting a lot longer. You cannot fix insulin resistance normally if you're doing 12 to 15 hours. You have to go a minimum 18, but preferably 20 or even more. Okay. Number 3, we want to handle any other problems than weight, other health problems. Okay. With her, it's the cycle. If you have a very severe menstrual cycle for 2 weeks, that is going to completely and utterly change your body chemistry. It's going to throw you off. It's going to make you hungry. You're going to be irritable. You're probably not sleeping. It could be a big barrier. Okay. So I think just by giving up the dairy, that alone will probably minimize this greatly. Other problems may be you can't sleep. You have sleep apnea, or you have a thyroid problem, or you have some inflammatory condition or autoimmune problem, or you have a digestive problem. I have videos on each one of these. I have quite a few on each one of these. You can search them out and find out what your weakness is, but you need to solve this other health problem right here. Next one, non-dairy keto bombs, okay? I already mentioned that. You can do keto bombs with coconut oil, with nuts, things like that. Okay, I also told her this is very valuable. To determine if you have insulin resistance, you want to do this test called HOMA-IR. A lot of times doctors don't even know about this test. You just have to find a doctor that does. Get this test done. It'll tell you how bad this is. So you have the right estimation of effort to solve this problem, okay? But the one factor to know if you're on the right track or not is this. Is your hunger going away? Okay, less hungry. If your hunger is going away, that means your insulin resistance is improving. If you can't go a long period of time, you can't fast between meals, we know you still have a problem with insulin resistance. So this is your best indicator, not your weight loss, nothing like that, but your hunger. And again, insulin resistance is a situation where insulin is not connecting to the cell. It's blocked. It's not allowing the fuel in there. So your cells are starving all the time, okay? And that's going to make it really hard to do intermittent fasting. All we're trying to do is switch you from sugar fuel to fat fuel step by step, so you're more over here. And once you're over here, it's going to be really easy. Hunger goes away. You have energy. You feel good. You finally lose weight. Thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.